Hello friends, I am Dr. Punit Pratap, a dermatologist and trichologist. I am working at Androgenic Skin and Hair Clinic, Noida. So today I will be speaking on hair loss. So let's start with the very basics. We have almost 1 to 1.5 lakhs of hair, and amongst these 90% of hair they keep on growing in the absence of any adversities. These are called anagen hair. Rest 10% of hair, they are in resting phase. So whenever we have some adverse condition in form of some medical condition, some medical illness, like when we have some fever, sore throat, cough, viral infection or like that, or in form of some surgical trauma, we underwent some surgeries or some hormonal factor, even sometimes after the seasonal variations, we start losing these hairs, which are almost 10% of the total count. And since these hair are called telogen hair, so we call this condition or this hair loss telogen effluvium. Usually this condition is transient. I mean, after these conditions once settle, so we start getting back these hairs. So this telogen effluvium is the most common cause amongst the females. Usually the underlying causes are inadequate nutrition in form of anemia, because the women of the childbearing age group, during their menses they lose their blood, so the hemoglobin is usually on the lower side. So most of the females, they have the hemoglobin on the lower side, so the anemia is the most common cause. So apart from that, the psychological stress, the lack of sleep, inadequate nutrition, and the pregnancy is another most common cause, following which females start losing their hair, okay, up to the next 6 to 9 months or up till 1 year. Again, this condition is the transient. When we maintain the nutritional status or the underlying cause is ruled out, these hairs are reversible. That means we get back these hairs. So in the males, the most common cause is the male pattern baldness, or which we popularly call as the androgenic alopecia. That means it is most of the time it's a heredity. That means we are carrying those genes from our ancestors, from our family members, which in presence of the hormones which we are carrying, they start thinning hair, and eventually we start shedding these hairs, which is called androgenic alopecia. So this condition is progressive. We start losing hair from the front, usually which manifests as the temporal recession from hair, and eventually it involves vertex and finally the crown. This condition is irreversible if we don't take any medications, or we don't take the measurements, so we eventually get bald over the period of time. So to start with, the best thing is to consult a dermatologist as we start the medications. At least these conditions can be stabilized, if not reversed. In most of these conditions, we start noticing hair loss when we see the strands of hair in our comb, or while we wake up on the pillows, or while shampooing. So hair loss can be prevented if we start the management a little earlier. The dermatologists are the right person to consult with, because the dermatologists are the only trichologists. So we have many medications for this, including the oral therapies, the lotions, the mesotherapy, PRP, and even the grade 7 alopecia, which is the most advanced form of the hair loss. This can be managed by the surgical restoration, that is the hair transplantation. So nutrition is the most important thing usually in females, and the hormonal factor and the genetic factor, these are the most important thing in males. So whenever we see hair loss, kindly consult your dermatologist early, so that this can be prevented and hair loss can be prevented. Because if we start losing your hair, it also has an impact on our psychological. Thank you very much, guys.